Hello guys, welcome to my channel A.Medical Knowledge. Here we are going to discuss about the surgery lecture number 3, soft tissue injury. In this video we are going to discuss about the soft tissue injury, how it occur, how many type, open or close, how we can treat, and how the process which are occurring in the injury we are going to discuss. First of all, we are going to discuss introduction. Soft tissue injuries are commonly which will be a cut or scrap. It is not a seriously life-threatening internal injury. Mostly the serious problem occur when it was gone to the internal injury where we can't see what happened. Do not distract by dramatically open wound. Do not forget airway obstruction. First of all, you have to distract it if this is open wound, because we have to stop the bleeding. Then airway obstruction, the air will not pass, so that the germs or a virus which are present in the air or in our surrounding cannot move to the wound if it is open. Soft tissue injury, there are many mechanisms due to which occur. There may be a blunt injury, there may be a penetrating injury, there may be a barotrauma injury or burn. Blunt injury, a sudden escape of something which can be a blunt, or penetrating, which are going to a deeper structure. If some person, for example, if the knife is cutted into your hand or goes into your hand, it affects the deeper tissue. It is penetrating. So that the barotrauma is something which is in the form of pressure hits you, and it's more commonly in ear or eyes, barotrauma injuries. And burn is something you are burned. And soft tissue trauma is a leading cause of injury or leading form of injury. Death most slowly occur due to infection or hemorrhage. Anatomy. First of all, now we are going to discuss about the skin and its anatomy. There is skin, which is our first line of defense. What is the function of our skin? First of all, it provides the protection. Secondly, it provides the sensation. It also protects our organs, internal organs. So skin is the most important element. The external forces, infection, it may protect. Skin is really tough, but it's still specific to injury. Simple bursts or abrasive to the serious lacerations or amputation. In all instant, you must, if you see if any injury occur, you have to control the bleeding, which is this is the important slide. You have to control the bleeding. Then further contamination decrease the risk of infection, because it is open wound, it may be infected. Use some disinfectant or other. Protect the wound for further damage. Dressing apply or bandage. Then skin varies in thickness, thinner in very young and very old, thinner in eyelid or lips. They are different. If you study the physiology in third year, you have discussed in physiology practical. You have to apply different tests for your eye, for your palm skin, and for the eye skin. ठीक है. Skin जो है is thick, more damage easily as compared to other. Then skin has two principal layers. First is epidermis, then other is dermis. Epidermis is a tough or external layer, or dermis is the inner layer which protect the organ. First of all, damaging effect occur in the epidermis. Epidermis is most important here, germinal layer, while dermis is the innermost layer, subcutaneous tissue. Skin cover all the external surface of our body. Mucous membrane secrete water substance, which we have already discussed. This is general anatomy or physiology. You have already learned it. External surface are mucous membrane, which secrete a water substance to lubricate and wet, whereas skin is dry. Skin may have many function: keep the pathogen out, water resist, regulate our temperature, nerve to the brain and environment sensations. Any break in skin allow bacteria to enter and raise the possibility of infection, fluid loss, or loss of a temperature control. There are two types of injury: closed injury or open injury. Closed injury is damage beneath the skin or mucous membrane, surface intact, while in open injury the surface is broken. As the name tells, it affects the deeper tissue or contaminated. Burn is the damage from a friction, toxic or electricity or nuclear radiation. Pathophysiology is closed or open. Sensation of bleeding is primary concern. Next, wound healing stage is inflammation. A new layer of a cell is moved to the damaged area. There is a new blood vessel formation. There is a deposition of a collagen which provides the stability, and damaged tissue won't bother. Pathophysiology, if we discuss about the temperature regulation, concentration, heat energy, or duration of exposure. The greater the heat energy, the deeper the one exposure is important. People reflexively limit the heat energy exposure time, cannot it unconscious or trape. Characteristic, first of all, you have to take in close injury history, then pain, then swelling beneath the skin. You have to discoloration. If you see the change in the color, and most commonly the bluish area or yellowish area, it indicates that something is happened. Bursars or contusions is cause of bleeding beneath the skin. As you have discussed, the area become blue. This is the bursars. Bruises built up by the blood produce blue or blackish. Hematoma is blood collection, damage tissue in body cavity. In crushing injury, when a great amount of force is applied, there is a crushed injury. The amount of force and length of a time it applied, it depends. Crushing injury mostly depend if somebody is, for example, if somebody is going on the road and a truck or a bus is just drag on it and it lay on underneath the truck. The we discuss this is the in the crush injury. We will discuss the amount of force and how much time it take. When the area of a body is trapped longer than 4 hours, crush injury can develop. 4 hours, more than 4 hours, this is the time period. Compartment syndrome, we always discuss, we have to make it different from the wound. We make it compartments where we have to tight or apply a compression in compartment syndrome, so that when we apply a tightly pressure on the specific part of area, the compression syndrome occur. Compression syndrome mostly occur by swallowing, whereas tissue injury, there are several close injury can damage it. Assess more serious sudden injuries. Open injury is where the skin is damaged. You can see bursa, laceration, penetrating wound. 4 types of these. As you can see, this is an open injury. A bursa is a wound superficial caused by friction when a body part rub or scrap through rough or hard surface. As you can see, in open injury, there is a laceration, jagging, cuts, sharp object blunted the force, incision, sharp, smooth cuts. Effluation separate various layers to soft tissue, so it become either completely detached or hang on the flap. There is significant bleeding. Nerve remain and effluation can flap. Amputation most commonly we have to do if the nerve is not intact. Penetrating injury, as you can see in the diagram, the nail is penetrating, so it's sharp and pointed and it damages the deeper structure of your body. Open injury is a stabbing and shooting resulting from multiple penetration. Carefully identify the wound, cut the number of penetration injury, then type, which is a type of gun or round fired, or documentary cover. You have to testify in the court. Then open injury, blast injury, primary blast damage of pressure, secondary from flying debris. If this is important, blast injury is type of primary where there is the pressure of explosion. If the skin is flying in the form of debris, then it is secondary. Tertiary, the victim explosives perhaps no into an object. If you like this video, please subscribe my YouTube channel.